Tonight on CBC Vancouver News.
We unfortunately have had a death here in British Columbia.
COVID-19 turns deadly. A resident of a North Vancouver care home dies. Also,
I have hand sanitizer, gloves, and a mask.
COVID-19 patients attended 2 schools in Surrey. And
the situation for all of us and the responsibility for all of us is significant.
BC's health minister and a top infectious disease expert will be here live at 6:30 to answer your questions.
This is CBC Vancouver News.
good evening. The spread of the coronavirus is hitting very close to home tonight. In fact, it has turned deadly.
The virus has killed an elderly man, a resident of the North Vancouver care home. Tina Lovegreen has more on Canada's first death from COVID-19.
The man lived in this senior's care home.
He was a man in his 80s, and he had a number of underlying health conditions, unfortunately. So in that risk group for people who are more likely to have severe disease with this.
Families with loved ones at the center are understandably worried.
This is absolutely my biggest fear, is that someone would pass away from this virus, and that that it would come to his care center. That's my biggest fear, because he is the least able to fight it off of anyone I know.
So far, her 88-year-old father with dementia isn't showing any symptoms, but he's got a compromised immune system and is considered high risk.
I just feel so helpless because we can't remove him from the facility or go there. 2
healthcare workers at the center have tested positive for the virus. So has another resident. Many more are being tested.
First, our condolences go out to the family, but I want to reassure Canadians that we have our top medical experts, our top scientists on this issue.
Officials are closely monitoring other care homes too. Healthcare workers often move around, working at multiple facilities.
There's obviously elements of concern for your own health and your own well-being, but also too, I think caregivers feel a great duty of obligation and service to the people that they look for.
The worry in BC is amplified by what's happening in neighboring Washington state. Of 22 people who have died there, 19 lived at this long-term care facility.
And the responsibility for all of us is significant to not go out when we're sick, to not work when we're sick, to not go to school when we're sick, but also to not visit care homes.
BC now has 32 cases, though the province's health minister says very few have required intensive care. Tina Lovegreen, CBC News, Vancouver.
And over the weekend, Fraser Health sent out an email to parents and students in the Surrey School District. It was to inform them that someone from Sullivan Heights Secondary School has tested positive for the coronavirus.
The Surrey School District has enhanced cleaning protocols, but the school remains open. Deborah Goebel spoke with students this afternoon who say while they may have showed up for class, they're still worried.
Oh, me too, bro.
High school is normally a time when being cool is a big deal. Chances are wearing a face mask and handing out Purell probably wouldn't qualify.
That's like round 3.
But these aren't normal days at Surrey's Sullivan Heights High School.
I have hand sanitizer, gloves, and a mask.
So we have Lysol wipes. We got wet ones just to
hand sanitizer, washing your hands for 20 seconds.
Yeah, just
hand
making sure that
yeah.
everything's just like
So when we walk into class, we're just like wipe down the table, let it sit for 10 minutes, and then like if we have gloves, put them on.
Because over the weekend, Fraser Health emailed parents and students to let them know someone from the school has tested positive for the coronavirus.
We disinfected all of the high-touch area, so this includes desks, chairs, doorknobs, light switches, everything. So the school was cleaned over the weekend and ready for classes on Monday.
Students say the school is definitely clean.
It smells like the dentist's office.
It smells like hand sanitizer throughout the entire school.
But they're still worried.
He probably got other people infected, because it is it's pretty easy to get It's a really contagious virus.
The school district says it's taking its direction from Fraser Health, and Fraser Health has deemed the risk to be low. It's also concluded the risk is low at Serpentine Elementary, where another person visited that has also been diagnosed with the virus.
There was 2 instances, and they're unique in that one instance is a member of our school community, and that's at Sullivan Heights, and the other is an individual that attended our school after hours for a community use rental agreement.
That doesn't mean everyone's convinced. At Sullivan Heights, more than half the students didn't come to school today.
On my first period class, I had only 3 other people in there. And in my second period class, we only had 4 other people in there.
Or kids in grade 12, though, trying to get into university, skipping school just isn't an option.
I feel like the school should be shut down because I feel like it's the best thing to do until this whole thing kind of blows over.
But in the meantime, that means taking every precaution necessary.
Just doing everything that makes me feel safe, basically.
Yeah.
Deborah Goebel, CBC News, Surrey.
A private school in West Vancouver has canceled classes over concerns about coronavirus. It comes as a precaution after learning a family with kids at the school has been in close contact with a patient with COVID-19. In a letter to parents, Collingwood School says Vancouver Coastal Health told them the risk is low, but just to be safe, they will close the school until March 30th, when classes are set to resume after spring break. In the meantime, the school will be deep cleaning both its junior and senior campuses with Clorox bleach. It says the patient is not staff, a student, or a family member from the school. More than 1,200 students attend both campuses.
That cruise ship with more than 200 Canadians on board quarantined at sea off San Francisco by coronavirus has now docked in Oakland, California. 21 of the people on board the Grand Princess, including 19 staff, have tested positive for COVID-19. Those in need of immediate medical treatment were taken to healthcare facilities on shore. The rest will be taken to federally operated isolation sites. 237 Canadians on the ship will be transported by a government-chartered plane to Trenton, Ontario. There, they will be assessed before undergoing a 14-day quarantine. The ship, with its 3,500 passengers, has been moored off the coast of San Francisco for days, just waiting for the go-ahead to dock.
What we're telling guests is, since most cruise lines are allowing you up until about the week of sailing to make that final decision, best to just hold off. Let's see how things develop.
Meantime, travel agents say fears of coronavirus are having a big impact on the industry. But with relaxed cancellation and rebooking rules, guests may not want to part with their plans just yet.
And there is fear everywhere over coronavirus. Between that and the oil collapse, there is fear now of a possible recession.
And as David Cochran reports from Ottawa, that could be a big hit to government revenues.
They rang the bell to open trading in North America, with alarm bells already ringing in markets around the world. Even without the coronavirus, it was not a day for high fives.
Canada is on the brink of a recession, but this government pretends that everything is fine.
The virus spreading, oil tanking, the stock market sliding, and the Deputy Prime Minister insisting Canada is prepared.
Canada's strong fiscal position means we have the firepower to support our economy, and we will.
This latest jolt is sparked by an oil price war between Russia and Saudi Arabia that is dragging down the rest of the world and sideswiping a Canadian economy already slowed by COVID-19 and rail blockades.
There are tens of billions available. There's plenty of fiscal firepower, if we want to use that word.
Even with a large deficit and a growing list of challenges, this former federal budget official says Canada is in a strong position.
We're not talking about the 2008 financial crisis. We're not on that scale yet. So, but I think we've learned lessons from everything from SARS to the 2008 financial crisis.
So the financial room to help is there. But how will Ottawa use it?
We're working on some responses right now. So I think what you'll see from us is a continued approach where as we have measures that we think are appropriate to roll out, based on the facts, we will do so, and you'll see some things this week.
So no specifics, just plenty of assurances to help. But while Ottawa has the capacity to respond, the real challenge is at the provincial level, especially in oil-producing provinces that have been struggling long before this latest price shock. David Cochran, CBC News, Ottawa.
And Canada's first death linked to COVID-19 in BC has left many on edge and many people with a lot of questions.
And because of that, we are changing course a little bit tonight. Coming up, we'll answer your coronavirus questions live. BC's health minister and an infectious disease specialist are joining us shortly.
So email us your questions at cbcnewsvancouver@cbc.ca. And the information's on your screen there. The phone number as well, 604-662-6801. They're going to be with us for half an hour starting at 6:30. You can also ask your questions on the CBC Vancouver Facebook page and YouTube page.
Door-to-door sales of home appliances are under fire tonight.
BC Solicitor General says findings by CBC Vancouver's impact team are appalling, so he is prepared to make changes to reel in the industry.
Impact team reporter Belle Puri has the story of one woman left with a bill 3 times more than she originally agreed to pay.
2 years ago, Harjeet Sidhu signed a rent-to-own deal for a new furnace.
This is the furnace they installed.
The door-to-door salesperson told her the total cost would be $6,500 payable over 6 years. All of that changed when Sidhu and her husband recently decided to buy out the contract. That's when Simply Green turned up the heat on them to pay a lot more than the $4,000 they thought they owed.
They send me that, the buying out sheet.
And it's $10,000.
It's $10,600.
When Sidhu called the company, it got worse. The person on the phone told her the contract was for 15 years, and getting out of it would cost $18,000, 3 times the original amount.
It makes me very mad, and it makes me feel stupid.
After talking to Sidhu, CBC contacted Simply Green. On the weekend, a company lawyer said the matter was resolved to Sidhu's satisfaction, but the details would remain confidential. In the last 13 months, Consumer Protection BC has fielded 31 calls about Simply Green. In 2016, the company was cited for engaging in deceptive acts or practices and fined $1,200. The Better Business Bureau says Simply Green has 3 complaints in British Columbia, but in Ontario, where it's headquartered, there have been 114 complaints in the last 3 years from across the country. Simply Green attributes the majority of those complaints to another company that it once financed. Simply Green says it hasn't gone door to door here or anywhere else in Canada since spring 2018. That's when Ontario banned the unsolicited high-pressure sales in that province. Alberta doesn't allow them either, and now BC is looking to follow suit. The Solicitor General says the details of Sidhu's case are appalling.
I've asked my ministry to look into this, and I am quite prepared to bring in legislation like other provinces to ban this kind of activity.
Door-to-door sales have particularly increased in the last 10 years.
My advice is to other peoples, don't trust those peoples. If you really want that, just tell them that, leave your contract here. We will go to the lawyer or somebody who can read this and explain that to us before they sign on anything.
Belle Puri, CBC News, Delta.
And that is an original story brought to us by you, our CBC viewers and listeners and readers. If you have a story you'd like our Impact team to have a look at, send us an email, impact@cbc.ca.
And we also want to let you know we have made the difficult decision to postpone the town hall on racism to a later date. As you know, there is intense public interest in the ongoing developments of COVID-19. As the public broadcaster, we are dedicated much of our resourcing and energy to covering the virus and covering the outbreak, making sure that Canadians are well informed. We want to make sure that the CBC Racism Town Hall gets the attention, resources, and coverage it deserves, which is just currently not possible.
And just a reminder, you can watch this newscast live on CBC Gem. The free app is also where you can find other CBC programs.
CBC Vancouver is also on Facebook, YouTube, and Instagram.
Why family court negotiations can turn into a nightmare for the partner of an abuser. Wonder Woman's story coming up.
Well, thank you very much for joining us on our live stream, where we are always ad-free during the TV commercial break.
Great. Tonight we bring you a look into the future of one of the pillars of this region's housing market, condos.
Voice-activated blinds, closets that steam your clothes, and remote-controlled toilets. Those are just some of the new features of one Toronto developer's smart home of tomorrow.
But as CBC's Taylor Simmons found out, with convenience comes privacy concerns.
What used to seem impossible or a thing of Bond movies is now at our fingertips.
Computer, welcome. Yeah, so the lights come on, the shades roll up. It's all tied into our smart home system.
And for the bathroom in this condo, you can pee in the same toilet as Drake.
Yeah, that's what's pretty special about this toilet. So it's actually the same toilet that Drake has in his own home. Drake has it actually set up to Tupac as opposed to elevator music.
And lastly, we have the master bedroom.
Right, this one's something special. So I can say, computer, turn glass on.
Whoa.
And now the glass goes from opaque to transparent. The idea behind this was that we wanted to provide the best of both worlds in terms of transparency and privacy.
This condo is a lot, but Tridel says their customers want more of it.
They want to be able to add features like digital thermostats. They want to do things like digital door locks and have wireless charging points put it throughout their suite.
What kind of data is being collected and who gets access to it?
But according to this privacy expert, although smart tech can have its perks, it can also come with a cost.
The risk there is that you've got a device in your home that is learning about your behavior, sharing that data with a third party. Brenda in apartment 2B has her temperature set 3 degrees higher than everybody else during the daytime. She's wasting energy. She's costing our building money. What should we do about that?
For Tridel's part, they say they've begun adding their own network infrastructure to their buildings.
On our end, this is mostly just to ensure the security. We don't necessarily do anything with the data at this stage, but it's more just to ensure that the privacy is kept, and that way it's not accessed by other people.
Turning on shower. Tridel says while certain features will become standard in their units, residents have the choice to opt in to others. Of course, for this condo at least, expect to pay a few million to get them. Taylor Simmons, CBC News, Toronto.
Always a price tag, right?
Okay, I might say something a little controversial, but at what point does it just become laziness?
You just get up and pull the blinds? Yeah. Maybe when the technology actually pays your mortgage or the rent for you?
Then you'll opt in.
That'd be great. All right, just a reminder, make sure you stick around for the second half of this newscast. We're going to have a live coronavirus Q&A with BC's health minister and an infectious disease expert.
You can ask your questions in our live stream chats right now on YouTube and Facebook. We'll be back with our regular programming in just a moment. Going to family court to negotiate custody is never an easy process, but for women with abusive partners, it can be traumatizing.
As Eva Yuguen-Senge reports tonight, a Vancouver lawyer says not enough is being done to protect women.
He banged the table, he stand up, his voice is very loud, and he used any kinds of F word, N word, and anything that, to me, it's a big threat.
Sarah spent 8 years in face-to-face mediations with her abusive ex-partner, all trying to get custody of her children. The mother of two spoke to CBC News on condition of anonymity due to fears for her safety.
Every time he heard something he's not happy, he going back to the violent again. So I feel most of the time that I feel hopeless.
This lawyer says Sarah's experience is common with the women they represent.
Women who were survivors of rape, and they were put in the room across from their rapist, and they were told by a judge, a person that they believed would be neutral and impartial, to consider their rapist's point of view.
And abusers can also wear down their ex-partners, both in spirit and financially.
He was waiting for me to lose my legal aid time so that I'm going to be alone and no help and no money, so that I had to agree with his whatever he wishes to it. So he's sending me that this is the time that you have no more legal aid, you have no more money. This is the time that I'm going to win over you so that you can give up your children.
Advocates say women with abusive ex-partners are better served by a trial in front of a judge.
Court is out in the open. There's a record. When somebody says something, generally speaking, they have to back it up with facts, or at the very least, the other side has a chance to question them.
Not all provincial courts have a formal screening process for domestic violence, but Attorney General David Eby says he wants to improve procedures.
We are working with the provincial court to refine their rules and improve their rules to reduce the burden on the court and families by encouraging mediation. But that does include as well a potential mechanism for family violence cases to be screened out.
Shannon says for that to work, more training is needed for the legal community.
Training on trauma-informed practice so that judges, lawyers, family justice counselors, at all levels, people at all levels can really appreciate the impact of trauma on a person's ability to give evidence.
Shannon is meeting with Eby this week to talk about how family courts can better serve women who've experienced abuse. Eva Ugwensenge, CBC News, Vancouver.
And a new law is in the works in several provinces to give police the power to reveal a person's previous domestic abuse convictions to partners who request it.
But as Salima Shivji tells us, details on how the law will be implemented in this country are still being worked out, and that has some worried.
Do you want to read it?
More than 3 years later, talking about it still takes its toll.
Curly hair like you too.
You feared for your life. Even when you say that, I get chills still. I didn't think I was going to make it out that day.
The hours-long beating at the hands of her ex, so severe, the responding police officer couldn't believe his eyes.
He said other than one woman lying in a pool of her own blood, he'd never seen anybody in that type of state.
That's you walking.
Patrizia Giampaolo found the strength to navigate the court system and press charges. That fact could now help other women because of a new law.
There is still a crisis of domestic violence.
Alberta is one of several provinces implementing Clare's law. Not only can victims ask if their partner has a history of domestic assault, police can also decide to tell them if they see a risk. One problem, this violence is a notoriously underreported crime. The stigma paralyzes many, especially in minority communities. Humera Falak works with victims to fight that reluctance to speak out. She's also been through it herself.
This is like emergency protection order.
A thick police file for 5 years of constant abuse with 2 kids she feared losing.
In that case, if there is no record, Clare's law won't really help. But that doesn't mean that it should not be there.
For police, it's a balancing act as provinces are still working out how much to divulge.
We want to make sure that we provide the information in a responsible way, but we also want to balance privacy of the people that they're making application on.
He says there will be extra support to help victims process any information they receive. That's essential for Patrizia Giampaolo. As unsure as she is about how the law will work, she sees it as an important tool to help women trying to find a way out of a vicious cycle of abuse. Salima Shivji, CBC News, Calgary.
And coming up in about 8 minutes at 6:30, BC's Health Minister and a top infectious disease expert are here to answer your questions about COVID-19. They're going to be here for half an hour. So send us your questions on email or social media or phone us, and we will try to get them answered starting at 6:30.
The weather update is brought to you by The Body Shop that always takes you back to your happy place. BC's favorite, Craftsman Collision, Air Miles, and Bigger Smiles.
Well, I know where my happy place is today.
Is it outside?
Right outside.
Oh, yeah. I had to comment on this, noticing that outside our studio right now, it is sunny. It is 6:27. This is a nice change of pace. We made it, everyone. Congratulations.
You had to go through a hailstorm on the weekend first.
Oh my gosh. If anyone else knows what we were talking about, very localized storm, very powerful. But we don't have any of that coming for this evening. But tomorrow, maybe a different story. I'm going to walk you through that right now, but let's take a look first at what this morning looked like all the way across the entire province. It started largely like this. We were dealing with very sunny conditions pretty well everywhere, lots of sunshine, though it was, of course, on the cool side. It's the benefit that you would have, or the consequence, I should say, of those clearer skies. Temperature-wise, we're pretty well where we should be, about 6 degrees or so, but Toronto today, the hot spot in the country, 17 degrees. Feeling very summery over there. Across BC, though, we were treated to lots of clear skies, and you're just seeing this cloud cover move in now, and that, of course, is going to be a little bit foreboding for what's going to be coming because, yeah, there's going to be a bit of rain on the way, and really, I shouldn't just say rain, because realistically, there is a chance that come tomorrow morning, as temperatures are very close to the freezing mark, places in the lower mainland may be experiencing a rain-snow mix. So if you're driving in from the valley tomorrow, say along Highway 1, be careful, because there may be a few slippery sections there, and that applies for pretty well everyone in the first couple of hours of the day. By the afternoon, it's going to just be a showery story. Temperatures still not approaching where we would expect them to, only going up to about 6 degrees or so, whereas normal for this time of year in Vancouver would be closer to 10, and that's what we're likely going to be seeing on Wednesday and Thursday onward. A look at our 5-day forecast. So yeah, a little bit showery when it comes to Tuesday, but both Wednesday and Thursday are looking quite nice right now. Lots of sunshine expected, and temperatures during the afternoon getting close to that 10-degree mark. We are going to finish off the work week, though, with a little bit more rain, but it is already looking good ahead for next weekend. Lots of sunshine, and temperatures are going to be pretty nice, I gotta say.
Love it. Thanks, Brett.
You're welcome.
Well, coming up next, BC's health minister and a top infectious disease expert are here to answer your questions about COVID-19. They'll be here for half an hour, so send us your questions on email or social media, or phone us, and we'll try to get them answered. That's coming up.
welcome back. Health officials are still saying the risk of getting coronavirus is low, but the numbers tonight continue to grow. And today, the country's first death linked to the virus.
Right here in BC, now the provincial health officer is urging everyone to take extra precautions.
Some of these closer environments, indoor environments where people do gatherings, where people share meals, where people spend a lot of time together in closed environments. And I'm asking people to consider having alternatives to those types of environments right now, particularly if they're being attended by people who are elderly.
2 residents and 2 workers at the North Vancouver Care Centre have so far tested positive for the virus. That brings the number of people in the province with COVID-19 to 32.
And with all these latest developments, we have decided to shift gears a little bit tonight. We've brought in 2 experts to take your questions until pretty close to 7 o'clock, so almost half an hour, right to the end of the newscast.
Yes, we have BC Health Minister Adrian Dix with us and Dr. Srinivas Murthy, an infectious disease expert and World Health Organization global researcher.
Yeah, so if you have questions about COVID-19 or the province's response to its spread, send us your messages as you watch us on Facebook or YouTube. We've got quite a few questions coming in already. You can also call the number that you'll see on your screen there as well.
All right, let's get started. Question first for you, Dr. Murthy. Jesse's asking, if someone who has been infected then recovers from COVID-19, have they actually built immunity to the virus? Can they get it again?
It's a good question, and we're learning more and more every day. And the most recent findings show that there is a pretty robust antibody or immune response to the infection. And so we're hoping that means you can't get reinfected. Obviously, it's still early in the outbreak, and so we can't say anything definitively yet, but the answer is hopefully yes. And that's going to lead into a lot of the vaccine science as well.
And you know, there's 32 cases in BC, but 4 have received 2 consecutive negative tests and therefore are no longer considered, their situation is considered resolved. So that has happened as well in BC.
All right. Minister, next question for you. It's from Facebook. Will there be dedicated COVID-19 test sites?
What we have now, we've done more testing than any other jurisdiction in North America up to this week. We've done 2,804 tests, I think, as of last Friday, and 2,008 individuals at that point. We've done more tests this week since then, and we'll be announcing the numbers Friday, than we've ever done before. Probably will double the number of tests we've done in the last week. We now have 5 sites for the test around BC, and we're continuing to build resources for more sites. What should be said about that, though, is at the time we announced that number, the 2,800 number and the 2,000 number, there were 21 positive cases. So the people we're testing are people who have symptoms and people who have essentially travel history or connection to travel history that would make them possible candidates. So we tested, of that group of people, 2,000 people at the time, and only 21 were tested positive. So that tells us that it is not yet widespread in the community, but that our efforts to identify cases have been helpful.
Okay, and Dr. Murthy, this question I'm hearing quite a bit. A lot of people talking about the flu shot and how that affects coronavirus. So if you've had the flu shot this year, does it minimize your risk of getting COVID-19, or does it minimize the effects of the virus at all?
So it doesn't affect COVID-19 itself. What it does affect is if our health system becomes crowded, if our emergency rooms become too busy, you are less likely to have the flu, and so you are less likely to seek out care if you have the flu shot. And so without a doubt, it's a very clear recommendation that getting the flu shot is very important. While not being directly useful for COVID-19, it does protect you against influenza.
Okay, and let's ask another question to you, Doctor. This is Claire asking, how long does the virus live on surfaces?
It's a common question. We just got this before we came up here. We don't have an exact answer. I think the lesson we learn is that keep your surfaces clean, like we should all the time anyway, and make sure that we keep our hands reasonably clean as well. And so the current recommendation is not putting your hands to your face that often. Just try to avoid that in general.
All right, another question for you, Dr. Murthy. Does water temperature make a difference when washing hands?
When we're washing hands with soap, no. And so this coronavirus is exquisitely killed by soap. And so a good hand washing, there's lots of songs out there that exist, 20 seconds of hand washing. What did Dr. Henry say? Something about jalapeno peppers?
That's right.
Yeah, that stuck with me. So wash it as if you're washing off jalapeno peppers and you don't want to touch your eyes.
Or you're putting your contacts in.
Just along those lines. And so temperature is less important than soap and time.
And it's important not to touch your face. I mean, as long as you don't touch your face, I think the doctor would tell you it doesn't come in through your skin, right? So that's why it's important not to touch your face.
Okay, Minister, here's a question for you. We're hearing about patients waiting for, in some cases, hours to reach a nurse, a healthcare professional on 811, and then receiving conflicting advice. Is there anything being done, this person asks, to unify those messages and maybe try to improve the wait times?
Well, I think on 811, I think the messages are generally consistent. They get at that number all of the most recent information, so it gets updated multiple times a day. We are going to increase our capacity on 811. Ordinarily, it's a very popular service. We get about 1,200 calls a day. We're getting well over twice that now, and we're going to increase capacity this week. I ask people to be patient because it is an excellent way to get both good health information and get advice on what to do next.
We have a question from Julie, who is wondering, and either of you can answer this, why is this pandemic so much more frightening than Norwalk or SARS?
Norwalk didn't tend to kill people, and so I think that was one of the main things that separates this. SARS did. But this is new, and this is spreading around the world, not just in a few isolated spaces. And so with that spread, it's causing a lot of sort of global disruption, you could say.
Okay. You get the mask question a lot, so we'll ask this one to you as well. Neil's wondering, if I wear 2 of those N95 masks, would I have twice the protection?
No.
Simple answer.
Simple answer there.
Good.
All right. Minister, when will screenings at airports become more stringent? This person says, I have been through 3 times and not one single check for COVID-19 or increased fever. I believe he's talking about YVR.
Well, it depends, of course, where you're coming from and where you're traveling from. Travel within Canada continues to be relatively safe. And so what the federal government is doing at the airports is letting people know under specific circumstances, if they're coming from certain places, letting people know what they should do. If they're coming from Iran, for example, the advice is to self-isolate for 14 days. They should be getting that advice. And we are getting the information now in public health of people who come in from Iran. Similarly, for example, people who are on the Grand Princess, the trip that ended February 21st, 2 of whom have been found positive. There's about 127 people, if you can imagine that, from British Columbia on that trip. And we received all the health information and engaged with them as soon as we heard there were issues involved then. I think a lot of people have argued for an immigration response to this. And an immigration response, all of our evidence tells us, all of our science tells us is not the right response. And without being critical of the response in the United States, there was too little testing and too much talk about immigration. What we need is for people to engage with us and to tell the truth and not sneak in and not sneak around and not pretend not to be sick, but to engage with us. The thing that we worry about most is not the cases that we find. In that case, we can isolate and address and assist and care for. It's the cases we don't find. So what we want is to use our tolerance as a strength here, which it is, and ensure that people contact us when they're sick so that we can help them and take action to protect everybody else.
Yeah, and Dr. Murthy, you've talked about the response at airports before.
Yeah, so the data for screening and being able to pick up new infections with widespread screening, it's not very strong in terms of the science. And I think Mr. Dix's messages earlier about how we need good engagement with the community and making sure people seek out care when they have symptoms. And if you're at the airport and have symptoms, to seek out an authority and get appropriately triaged that way.
Anita?
Okay, Dr. Murthy, a question from Adam Humphreys. What are the developments on a vaccine? Where do we stand with that?
Yeah, no, it's actually progressing faster than most prior illnesses. That being said, it's quite a deal of work to create a vaccine. First, you have to integrate the science, and then you have to make sure it's safe, and then you have to make sure it's effective. And so that whole process will take probably a year. And so likely next spring is when we're starting to first hear actual human studies being done.
And just out of curiosity for that, would someone, I mean, obviously it hasn't been developed, so you probably don't know this, but would someone have to take it like they would the flu shot as a preventative, or would that happen after you actually get it?
So it would be a preventative, and so you'd have the vaccine, and hopefully it would be effective, so you would not get this COVID-19 infection. Whether it's a one-time shot or a series of shots, impossible to say at this point, and a lot of scientists are working on that right now.
All right, so a question for you, Minister. The majority of these infections have been in elderly people. We have hardly seen any cases worldwide of, in the age group, I think, of 0 to 10, a very low percentage. But here's a question from Barbara asking, what about daycares, elementary schools? Are you considering closing them as toddlers are always sharing viruses? Fair question.
Well, just on the first part, a majority of cases involve traveling, right? Either you know someone who's traveled or you travel, right. Which means often the people who have been diagnosed positive with COVID-19 in general have not been the most vulnerable people. They're people who travel internationally. They have means. They tend to have houses or their own apartments, as the case may be. And so that's been what it's been like so far. But I think today's case, which has saddened everybody, the case at Lynn Valley, shows who's vulnerable here. And it's the mortality rate, the big study in Hubei showed this, 14.9% over 80 and almost non-existent under 40. So that show in terms of a mortality rate. But I think obviously that's what we have to start to look at now. And one of the key parts of the plan that we're putting together if things get considerably worse, is how do we protect vulnerable populations? And those vulnerable populations are not simply those in care homes, although they're pretty important, those in hospitals, although they're obviously very vulnerable, but other vulnerable populations, people who have chronic diseases of various kinds, from addictions to people like me who have type 1 diabetes.
Okay, we are going to take a quick break at the moment. We will be back shortly here, so stick around with us. We have lots more questions that need to get answered, and if you do have any questions, you can submit those on Facebook, on YouTube. You can tweet us, or you can call the number that has popped up on your screen here at CBC. So stick around, we will be back shortly.
So you're getting on a plane, well, this is what you need to know to protect yourself against COVID-19. My name is Professor Keith Warriner, and I research into microbiology. Be aware of your surroundings. One row behind you, one row in front of you, and one row across. Definitely, if the person in front of you, behind you, beside you are showing symptoms of coronavirus in terms of fever, dry, persistent cough, make alert the attendant who can take them off or move you from the position. Disinfect the contact surfaces. That means armrests, it means buckles, it means tables, it means the actual touch screen. Wipe down the surfaces. Make sure our surroundings are disinfected. And we can do that to a degree using hand sanitizer, but that hand sanitizer has to be above 60% alcohol content. Those other sanitizers don't really cut it. The air blower above your head, if you just position it so the air flows in front of your face, you kind of make an air cushion or a curtain. And what this does is obviously stop droplets getting onto your eyes, your nose and your mouth. Again, not 100%, but at least it's a degree of protection. So first switch the water on, get some soap. So the water doesn't have to be super hot, and it doesn't have to be super cold, because that refrains from you washing your hands. What you've got to really focus on really is the tips and the nails, because they usually get missed, and they're the things that you touch with. So once you've lathered them, you can wash off the soap, and you get a paper towel, and this actually is a more important part of hand washing, because you actually remove more microbes doing this than you actually do washing. And you don't want to touch the faucet physically, so use your paper towel and then just turn it off, and you can use the paper towel also just to open the door.
Welcome back. We are taking your questions on various platforms, even over the phone, with our two guests, Dr. Srinivas Muthri, an infectious disease expert, and BC's Health Minister, Adrian Dix. And we wanted to pick up just briefly on young people.
Yeah, you made the point earlier about rates of infections in kids being low, and it's actually the rates of infections in kids are comparable to those in the elderly. It's just that they're not as severely affected. And so their mortality rate is much, much lower on the scale of even 0 to 1%.
And Minister, you just
so we're going to be connecting, because you asked about daycare, and we were talking about some other things, but daycares and schools are an important consideration here. And obviously, we don't feel at present there's any justification for closing schools, and there are consequences to doing that as well. Kids losing their education, of course, but also they do go places when they're not in school, right? We know this. So well, that's absolutely something we'd be prepared to do, either in the case of a daycare or in a school. We would be following the appropriate risk assessment for people involved.
Okay, Dr. Murthy, Gail MacArthur's asking on Facebook, I'm a senior with several chronic health conditions, wondering if it's wise for me to attend a yarn show over the weekend, or really you can talk about any crowded show or event, you know, people handling maybe even the same products and passing them around, things like that.
Yeah, and I think the current recommendations, and these things change, will be that those who are vulnerable, like Gail here, may want to stay away from these large gatherings with lots of people. Whether that's a permanent thing or whether that's a short-term recommendation, it's difficult to say, but likely just for the foreseeable future.
And stick with another one with you. Yuri's curious to know about transmission. How is this virus being transmitted the majority of the time? Is it person-to-person contact, or can it happen through ventilation, large open space, et cetera, et cetera?
Likely it's person-to-person contact, and so most of these viruses are expelled when we cough. If they get on your hands and then you rub your eyes or rub your mouth, then you have acquisition of that virus. And so if you can imagine just keeping your hands clean and away from your face, as difficult as that may be sometimes, you can be protected or feel reasonably confident that you're protecting yourself against the virus.
And talking about hands being near faces, you know, obviously we're seeing a lot of masks around. Hattie rather, is wondering if those face masks are reusable.
No. And so for them to be effective, they should be used freshly. And that's why in hospital settings, we tend to recycle them go through them quite frequently. And honestly, reserving them for the hospital settings in the context of especially an outbreak where there may be some strains on those supplies would be very important right now.
Okay, a lot of people with travel plans. We heard what your advice was with respect to cruise ships and what have you, but let's talk specifically about destinations. Europe, for example. A lot of people with travel plans to Europe.
Yeah, and there are pockets in Europe with high spreads of transmission. And to be truthful, a lot of friends of mine have canceled their trips to those regions. Whether there's a travel advisory or anything along those lines, not yet, and I'll leave that to the politicians to make those calls. But it's an individual risk assessment each time.
Well, the travel advisory, and the travel advisor is not just politicians, thankfully. It's, in this case, the person leading that would be Dr. Tam, who's an outstanding person to lead that, right? And so when the federal government gives advice, I mean, as Dr. Henry and I did this weekend, and the federal government gives advice not to go on cruises right now, they do it for serious reasons, and it's based on the evidence, and I think that's important. So on the cruises, yes, but we've seen what's happened in Italy. That situation emerged very quickly, actually. It was, and what you're talking about in Italy is a very advanced healthcare system, obviously a very advanced society, quite a prosperous society by any standard in the world, and the events that we've seen transpired. So I think one of the things when you're going on business and you don't need to go, for example, or going pleasure and you don't need to go, is to figure out whether you would be prepared if the circumstances came around to withstand being quarantined in a place that has some risk. There's 900 cases in France, there's a lot of cases in Italy, and the situation is changing, so stay up to date on those things and make any decision you have with all the risks in mind.
Dr. Murthy, we have a question from Tracy. What is the expected length of this outbreak? 3 months, 6 months, 12 months or more? With the onset of warmer weather, will the situation improve?
The short answer is I don't know. And it's also the long answer in the sense that there's so many variables that are feeding into this, and lots of smart people have done lots of different scientific models to see if this happens, then this would happen, but we really don't know at this point.
But I think the important thing is why we want to slow it down, and why we're working so aggressively to slow it down, is if you look at healthcare resources, for example, to the extent that we push this past cold and flu season, even if it doesn't end during cold and flu season, we have more resources for everything else and more resources for dealing with it. So what we're trying to avoid, amongst other things, is a spike in cases. What we want to do is push it along and really do what we're doing, which in what Dr. Henry has directed and what our whole team has directed, which is to attack every case, try and contain every single case to limit the number of cases in the community.
But a lot of talk of, the virus will go away once summer hits because the flu always go away when summer hits. I think the answer is...
It's a new virus, and so we're still learning about it. And so we'll figure out what happens in that context in a couple of months.
Yeah. Okay, let's get to a couple of quick ones here. The question is from Violetta. At the primary health care level, are doctors being encouraged to offer more virtual care to patients to possibly stop any potential spread/exposure in waiting rooms? You both might want to tackle that.
That's yours there.
Well, yeah, and we're obviously going to advance and support as much as possible primary care doctors. What we really hope people do, if they have respiratory conditions, is call ahead so that everyone understands what the circumstances, so you can be protected and everyone else can be protected. So if you have a respiratory condition, you feel you need to see a doctor, which could be influenza, which, by the way, is very serious in its own right? Then it's important to call ahead to your primary care center and make sure, or if it would be necessary, to the emergency room, or if you're suffering severe case and you feel you need to call an ambulance, to call ahead and let people know so they can be prepared to properly treat you and ensure they're protected and you're protected.
I'm going to break all the rules here and merge two questions into one. What should I use to clean surfaces, and what surfaces should be cleaned?
So typical soap and water or whatever disinfectant you usually use almost to keep your surfaces clean would be effective against this virus. And then the second part of the question, which surfaces? The surfaces that you use a lot. And so, for example, this table that I'm resting on would be a great example of a surface that should be cleaned after we use it. Your kitchen counters, your dining room tables, your windowsills, places where you handle frequently.
Okay, this is particularly relevant considering the situation in North Van. What's the situation regarding local senior centers? Is it still safe to go to them?
Well, first of all, if you're sick, don't go. And I can't say that again. If you're sick, don't go. Don't go out, but certainly don't go there, because people are more vulnerable there than anywhere else. We don't want people to not go entirely. I mean, these are people's homes, right? Mm-hmm. And support to them is important for their overall health. And so if you're well, absolutely visit your loved ones. But if you're at all sick, make sure that you don't go so that they're protected. And by the way, that's true anytime, particularly in long-term care. We have 29,000 publicly funded long-term care beds in BC, and what's called the rate of acuity, meaning how sick people are in a sense when they're there, is very high. So it's really important to respect that, and it's part of our civic duty to one another, I think, right now, is to not go out when we're sick, and that means not go to the long-term care home or not visit our loved ones, our mother, our grandmother, when we're sick. That's our civic duty right now.
We have just about a minute left, so final thoughts from both of you. I know you can't predict this, but what do you expect to happen in the days to come?
Go ahead.
Well, we have to continue to do our work, right? Which is to keep the public informed, to give the public agency, to give people out there agency. This is what you can do to protect yourself and your family. So that's why we're briefing every single day. Do not believe rumors. Do not believe any rumor of a case. We will tell you every single day if there's a case, and if the last 14 days have told you anything, we're prepared to do that. And we'll do that and brief every single day. So listen to good science. Listen to people such as Dr. Murthy and Dr. Henry. Listen to them to get your information and not that. And I think in terms of the public health system, we've got to be prepared for it, because many other excellent public health systems, Japan, Korea, and Italy, for example, the United States, Washington State, which has outstanding public health officials in their state, have had serious problems. So we've got to work hard and understand with modesty that the world is interconnected, and no matter how good we are, things can come here too.
Okay, just about 30 seconds left for you, Dr. Murthy.
Just not much to fill in after that. Just effectively just prepare with cautious, without fear, I guess you could say. And trust our government officials to have all of the recent data. They're keeping tracks of all of what's happening around the world and making sure that people have all of the data they need to to fill in all of their decision-making processes.
Dr. Murthy, Minister Dix, thanks so much for being with us tonight. Thank you, for your excellent questions, for sure.
You can always find our news program online, cbc.ca/BC. Dan Burrett is here at 11 o'clock after the National. And if you do want to see any of those answers again, if you didn't catch our entire broadcast, that is available online at Facebook or YouTube. And hopefully you can get all those questions answered. And if you do have more questions, feel free to keep sending them in.
Absolutely. Thanks again for watching. We'll see you again tomorrow.